Yesterday, a technician came to my apartment in Mexico, drew blood in under 5 minutes, and left. I barely had time to set up my camera to show all of you. So what you're about to find out is what that cost and what the same panel runs in the United States. The gap is going to bother you. Bothered me. Let's talk about why you haven't done this yet, because I already know the answer. I hear it constantly from the men that I work with. Cost, and the sheer hassle of the system. In the United States, a comprehensive panel typically requires a GP referral. That's a separate appointment, a separate wait, and a separate bill before a single vial of your blood gets drawn. The average wait for a non-urgent GP visit, over 20 days. Then you have to drive to the lab, you have to sit in the waiting room, and then you pay. And the bill is part of what stops most people cold. I'll show you that number in a moment. And when I do, I want you to hold it next to what I paid here, because the comparison is exactly why this conversation belongs in our channel about living abroad. But before the numbers, here's what the delay is actually costing you. The conditions that kill men and women early almost always show up in blood work years before they show up as symptoms. Cardiovascular disease, metabolic breakdown, hormonal decline, and cancer. Caught early, completely manageable. Caught late, you're not preventing a crisis, you're responding to one. I've spoken to men in their 40s and their 50s in consultations who haven't had a panel done in years. Smart, organized men who would never ignore a warning light on their car. Now, women tend to be more proactive, but they can't escape the time and financial costs associated with that proactivity. Every single time, cost and friction causes people to put off monitoring their health. Both of those excuses, though, end today. Beyond the blood work specifics, this is the first in a series of practical daily life upgrades that come with relocating abroad that nobody covers in the residency conversations. Healthcare is just the beginning. Subscribe and follow along. There's a lot more where this came from. Now, the numbers. A comprehensive men's panel at Labcorp, the custom men's health test, which covers your metabolic panel, complete blood count, hormone levels, including testosterone, thyroid function, heart health markers, and a prostate screening, retails about $641 out of pocket. Women's panels can be similar, but since I don't get them, I won't pretend to relay the specifics to you. No referral is required through Labcorp's on-demand service, but you're still driving to the location, sitting in the waiting room for up to an hour, and paying $641 minimum. My panel in Guadalajara, $260 total, and the tech came to my house. You're watching that real video inside this one. No extra charge for the visit. The results were the next morning. That's geographic arbitrage applied directly to your health. Most people think about geographic arbitrage in terms of rent and cost of living, and those numbers are dramatic when you relocate to a place like Mexico, but it applies equally and sometimes even more to things like healthcare. And most people making the case for a second residency abroad never mention it to you. That price gap, though, it's significant. But honestly, for most men, it's not even the biggest barrier. Stay with me, because the friction argument is what actually drives the avoidance. To get a comprehensive panel through a traditional US doctor, you need a GP referral. That means scheduling a GP visit. The average wait time in the United States for a non-urgent appointment, over 20 days. Then there's attending that appointment, paying your copay, waiting for the referral to be processed, scheduling the lab separately, traveling to the lab, waiting again, and of course, if you have to take time off, dealing with your employer on the subject. Now in Mexico, I messaged the lab directly on WhatsApp, basically a text message. Scheduled it the same week, someone knocks on my doors, done in 5 minutes. No referral, no waiting room, no insurance negotiation. So whether you're a digital nomad working remotely or someone who is retired abroad or in the process of relocating internationally, the friction argument there disappears entirely when you're living inside a system built around accessibility rather than gatekeeping. The cost is solved, the friction is solved. So here's what expats who figured this out actually do with that access, and you can model this exactly. So you establish a baseline year one, a full comprehensive panel, everything measured, everything documented. Then you repeat it annually, not because something's wrong, but because now you have trend data. You know where your testosterone was at 22, 32, and then at 42. You know how your lipid profile shifted after you changed your diet. You have a continuous picture of your health, not just a snapshot taken after a 5-year gap when a doctor finally forces the issue on you. That's how you catch things early. That's how you stay ahead of the curve instead of responding to a crisis. I know my testosterone levels, my metabolic panel, my thyroid numbers, my lipid profile. I have the data, and I got all that data for $260 with zero friction on a Tuesday morning in my own apartment. It didn't take any time out of my day to get it done. This is the part of the conversation that almost never comes up when people are researching second residency options, and it should. It's one of the most important things to absolutely everyone. And here's why I bring it up with every client that I work with. When I work with people on their Mexican permanent residency pathway or any of the other countries that they want to move to, the conversation always starts with the visa paperwork, and it should. But it doesn't take long before people start asking about the daily life, healthcare, the cost of living, logistics. What does it actually look like to operate somewhere as an expat? That's what I map out in consultations. The legal pathway to permanent residency, yes, but also what your life could look like on the other side of that process, including all of the major benefits. So whether you're a remote worker, a retiree moving abroad, or a digital nomad ready to plant your first flag, if you're past the research phase and you want to have that conversation, the link to book is in the description. Here's the simple version. The two reasons don't get blood work done, and you've probably told them to yourself at some point, are cost and friction. In Mexico, the cost is only $260, less than half of what it is in the United States, and the friction is absolutely non-existent.
It took all of about 8 minutes.
Someone comes to your door to take care of it. So all of your excuses are gone, and you can finally start taking care of your health the way you know you should be. If you're already living abroad, make sure you do this. Set up your baseline this year. It's accessible, it's affordable, and the information you get back is genuinely valuable to your longevity. If you're still stateside considering the move, add this to the list of things that will change when you establish a second residency in Mexico if you want, just like I did, or anywhere else. It may not be the most dramatic benefit, but it certainly is one of the most practical and one of the most important. This isn't complicated, it's not scary, it's one of the simplest, most actionable things you can do for yourself and your family. And living here makes the cost of it almost completely non-existent. Don't keep guessing about what your health numbers actually look like, and do not keep guessing about how to position yourself where the kind of access to that sort of health information becomes normal. There are two resources in my description. My 68-country Digital Nomad Visa guide if you're still mapping out your options, residency pathways, cost of living comparisons, and visa requirements across the countries most relevant to the people on this channel. And the consultation booking link if you're ready to move to a Mexican permanent residency and you want a clear, mapped out path how to get there. Both of those links are in the description below. The right information makes it all possible. I'm Brad with Evolution Expats, and I'll see you in our next video.